I just wanted to ask how you see this collaborative trend that you've been discussing changing the landscape of healthcare innovation as a whole.
I see the collaboration happening on multiple fronts. We talked a little bit about the partnership with Microsoft. We're partnering with other tech companies like Nuance. I think COVID also showed what, we can do with other health systems. I really was happy to see health systems sharing data and the way we're treating COVID patients and whatnot. So I just see overall, partnering with our communities, partnering with state and local governments, partnering with other health systems, partnering with other tech companies. Everybody's got our patients and our community's health at the forefront. And I think we're only going to move things forward through those collaborations. I've witnessed it firsthand, very different from the tech industry. We didn't see that kind of collaboration. Yeah. So great to see that collaboration here in health. And I think it's going to be critical on delivering on those innovations we need for our communities.
Is there anything else that you wanted to cover, that you wanted to share, that any projects or success stories that Providence is working on the innovation side that we haven't discussed?
I just want to personalized medicine is, really why I joined. As you pointed out, medicine is more episodic, right? Me as an individual, I decide whether I'm going to come in for care. I'm a horrible patient. I usually decide not to come in for care until it's too late. And so personalized medicine, I think 10 or 15 years ago meant, a doctor that was kind of looking over our shoulders to ensure our care. I think the future innovation will be these health bots that can manage and monitor our data in real time and kind of reduce that signal to noise, right? We can't have doctors and nurses always responding to the data. And so how do we really tune these health bots to monitor the health of an individual and give feedback to the individual? Hey, course correct here or there, here's some feedback, or pull in a caregiver when appropriate, telehealth consult or bring somebody in. I think the scale and extensibility we can only get with artificial intelligence is really the only way we deliver on that personalized care. Unless you're Bill Gates and have a personal doctor following you around, for most of us, it's really going to be done through technology. And so I'm really excited to see what happens over the next 5 or 10 years to improve the health of each individual and our communities, right? Because it's going to be community health based. Each community may have unique health issues as well that we can partner with those communities to improve their health as well. So I think you described exactly why I left Microsoft and why I've joined Providence and then healthcare. I think there's so much technology can do to deliver healthcare in a more effective way for our patients and communities. And I love being at the forefront of that here at Providence.
Well, thank you for being my guest. BJ Moore, Vice President and Chief Information Officer for Providence, graduate of Colorado State University. Looks like a beautiful view. Is that Seattle in the background there?
That is Seattle in the background, and one of the rare blue sky days in March. You may have captured maybe only 2 or 3 of the sunny days we've had this year.
Good timing. Well, thanks for spending some time with me today, BJ. You can find BJ Moore on LinkedIn. You can find myself on LinkedIn at Dr. Josh Luke. Thank you for spending some time with me, and we're real appreciative of all the efforts that Providence is doing as a ministry and a health system to bring healthcare into the home, to use that innovation and to just help us live a healthier lifestyle. So thank you so much, BJ.
Thank you, Josh. Really a pleasure to be here, and thanks for the opportunity to share our story.